Back. In today's session, we are going to discuss about Ascariasis. It is a continuation to the chapter Epidemiology of Communicable Diseases. Ascaris lumbricoids are commonly known as roundworms. The objectives of today's session is to define Ascariasis and the geographical distribution of Ascariasis lumbricoids, the prevalence of Ascariasis, the epidemiological features which include the agent factor, host factor, and environmental factor, the life cycle of Ascariasis lumbricoids, the clinical features which comprises the signs and symptoms, then comes the diagnosis, how we can diagnose it is Ascariasis, and then we will see what are the differential diagnosis to Ascariasis, the management, allopathic management, and then we see the prevention and prophylaxis, and lastly the National Deworming Day will be discussed. So let us begin this session with the definition of Ascariasis. What do you mean by Ascariasis? Ascariasis is an infection of the intestinal tract caused by the adult Ascaris lumbricoids. Is it clear? It is an infection of intestinal tract. Okay. Most commonly the small intestine. So it is an infection of the small intestine or the infection of intestinal tract caused by, who is causing this infection? There is an infection. So who is causing this infection? This infection is caused by Ascaris lumbricoids. Ascaris lumbricoids. You can see the male and female Ascaris lumbricoids, and then we see it is clinically manifested by vague symptoms. They are not very clear. It is vague symptoms of nausea, abdominal pain, and cough. Is it clear? So the patient has cough, he has nausea, abdominal pain. Is it clear? We move further with the geographical distribution. It is cosmopolitan in distribution, being specifically prevalent in Southeast Asia, China, and India. Its prevalence rate, it is more commonly found in Southeast Asia, China, and India, but it is cosmopolitan. What do you mean by cosmopolitan? When an organism is found in most of the parts of the world in appropriate habitats, then it is known as cosmopolitan. It is widespread in many habitats, it is found. Then it is cosmopolitan in distribution, more prevalent in Asia, Southeast Asia, China, and India. Moving further to the prevalence rate. So the prevalence, 820 million people are infected worldwide annually. So we see that it is estimated that 820 million people. Shall we mark it down here? Yes, 820 million people. 820 million people are estimated to be infected worldwide annually. In a span of 1 year, 20 million people are affected. And out of these 820 million, 12 million acute cases are found, and the mortality is 20,000. In those acute cases, we have mortality rate of 20,000. And then the morbidity is seen in the children in approximately 1 lakh children. 10 lakh children, they are presenting with malnutrition and pulmonary complications. Under the complication aspect, we will discuss later how this malnutrition, how the pulmonary complication is seen in cases of Ascariasis. Now in the prevalence, you are going to write down 820 million people are infected annually, out of which out of the 12 million acute cases, 20,000 deaths are seen, mortality, and the morbidity is most commonly presenting with the malnutrition and pulmonary complication, and it is more commonly seen in the children. Okay, it is more commonly seen in the children with the age group of 3 to 8 years. Now we will move further with the epidemiological features. Let us begin with the agent factor. We know what is the agent here, Ascaris lumbricoids. Okay, the agent is Ascaris lumbricoids. Yeah, agent factor is Ascaris lumbricoids. You can see the picture here. And then we see this Ascaris lumbricoids is living freely in the lumen of the small intestine, and the sexes are separate. Then comes the habitat. It is seen in the lumen of the small intestine, the jejunum. Here you can see the intestine. This is the liver, and this is the stomach. And then we have duodenum, jejunum, and ileum. A quick revision with the anatomy. This comprises the small intestine, and here the roundworms will live freely. Okay, they live and move about freely in the small intestine. You know the parts now: duodenum, jejunum, and ileum. Here the roundworms are living freely, especially in the jejunum aspect. Okay, in the jejunum, then they move about from the duodenum and ileum and all. More commonly, it is in the jejunum. It is in the jejunum. Yeah. Moving further to the lifespan. The lifespan of Ascaris lumbricoids ranges from 6 months to 12 months of an adult. Okay, lifespan of an adult is between 6 to 12 months. Maximum it is reported being 1.5 years. The lifespan entirely, the worm lives up to 12 months, like 1 year. Maximum it can live up to 1.5 years. Then comes the reservoir of infection. Man is the only reservoir of infection. Unfortunately, man is the only reservoir. Then comes the infective material, the feces which are containing the fertilized egg. Is it clear? What is the infective material? Material which is infective is, which is causing the spread, is the feces of an infected individual, where he sheds those eggs, where he shed the worms. They are going to infect the other individuals through the fecal-oral route. So we see that the infective material is the feces of an infected individual, which is containing the fertilized eggs. Then comes the host. The infection rate is tend to be higher in the children. We saw previously that it is highest in the children aged 3 to 8 years. They are the most important disseminators of infection. And then we see adults seem to acquire some sort of resistance against the roundworms, and there is a high degree of host parasite tolerance in the adults. These roundworms, they mainly infect the children, and they rob off the food, and possibly they are also competing for the vitamin A in the intestines. Thereby the children become very malnourished. Malnutrition is commonly seen in the children, especially they are present with growth retardation. Is it clear? How is it infecting the children? It is robbing off the all the nutrition whatever the baby is taking. Once it is reaching the intestine, instead of getting absorbed and storing in the child's body, this nutrition is grabbed away by all the worms. They eat away all the nutrition, half digested food in the intestine. They take away all the food, and the child is deprived of nutrition. Then the child can present with mental retardation, slower growth, not reaching milestones on time. And then he also can present with kwashiorkor, marasmus, all of these. Is it clear? This is the host. Infection rate is higher in the children 3 to 8 years of group. Moving further to the environment. In the environment, eggs remain viable in the soil for months. Okay, the eggs are remaining in the environment, in the soil, for months or years under the favorable conditions. So we see that the soil, seeding of the soil by the Ascariasis egg, it takes place by the human habit of indiscriminate open air defecation. So in the environment, the human habits, like whenever the soil is the people do open air defecation, even in the rural areas where the sanitary latrines are not established, in the slums where there is no proper hygiene facilities, they seed the soil by feces. So because of the indiscriminate open air defecation, which is a human habit, this leads to the soiling of the soil by Ascariasis eggs. and this has become an important factor which is responsible for the distribution of Ascariasis all around the world. So we know that whenever that soiled polluted soil that is used for growing the vegetables, the same soil which is contaminated, the same vegetables which are grown in this contaminated soil without the proper washing, without the proper cooking, if they are consumed through the fecal-oral route, they can cause the infection. So the mode of transmission is fecal-oral route. The inhalation of the desiccated eggs in the dust can also reach the pharynx and swallowed. So it is not just the ingestion of the thing, even the inhalation is also playing a role. Is it clear? It is not just ingestion. Whenever the patient ingests the food, he develops with the symptoms. Not just that, only if the eggs are inhaled, okay, if it is inhaled by the people, the dust is reaching the pharynx, and whenever it is swallowed, it can result in Ascariasis. Is it clear? Okay, we understood how the fecal-oral route takes place. The soil pollution usually concentrated around the houses. The small children have no regular habits. They what do? They pollute the houses. They pollute the surrounding areas. The children are not trained properly, so they go do open air defecation. Then they pollute the small houses, the areas around the houses. They have no proper habits made by the parents, so they do open air defecation, and they will pollute the house. They will pollute the surrounding areas, and the infective eggs will easily reach the other children who play on the grounds, and they play in the mud, so they will contaminate their hands and the food, and from there, from the contaminated hands, from the contaminated food, the inpatients get the other children or the other individuals get infected. Then comes the period of communicability. Until all the fertile females are destroyed and stools are negative, the patient is communicable. He keeps on spreading the infection or shedding the fertile eggs in the stools until all the fertile females of the Ascaris lumbricoids are destroyed and the stool test turn out to be negative. Up until then, he is infective. What is the period of communicability? Until all the fertile females are destroyed. Until the stools are negative, the person is communicable. Then comes the incubation period. The incubation period is 18 days to several weeks. Okay, from the time of ingestion of the eggs to the presentation of the complaints, the time taken for the inhalation or the ingestion of the fertile eggs through the fecal-oral route or through the inhalation, then the patient presents with vague symptoms like nausea, abdominal discomfort, cough. All of these symptoms till the presentation has come, the time period between the ingestion to the presentation of complaints is known as the incubation period, and the incubation period in cases of Ascaris lumbricoids is 18 days to several weeks. Now we will go to the structure. Then we see that the female measures about 20 to 35 centimeters in length. Okay, female is, you can see the picture here, the female is measuring about 20 to 35 centimeters in length, whereas the male ranges from 12 to 30. Okay, male is shorter. Okay, the male is shorter, and male you can see the penile setae, and in the female they have a straight tail, they have a curved tail. This is the anus. This is the cloacal aperture in the male. Here females have a female gonopher. This is a lateral line which is common. The excretory pore is common. Is it clear? You can see? Yeah. So now we see that the triradiate mouth with lips. The two female and male, both of them of the Ascaris lumbricoids have the mouth with the lips. Triradiate mouth. Okay, they have a triradiate mouth with the lips, excretory pore, lateral lines, female gonopher. You only have to draw a curved tail for the male and a straight tail for the female, and they have a penile setae. Okay, and then we see how many eggs do a female lay in a day? She lays about 2,40,000 eggs in a day. So we see that egg production is very high in the females. It is an estimated that 2,40,000 eggs per day by each female Ascaris lumbricoids, which counterbalances the heavy losses in the environment. No matter how many eggs are shed through the feces, whatever the loss is into the environment, the female quickly lays about 2,40,000 eggs per day. The eggs are excreted in the feces. They become embryonated in the external environment. Once they are excreted out, these eggs will become embryonated in the external environment, and they turn out to be infective in 2 to 3 weeks. Is it clear? So let us see the life cycle of Ascaris lumbricoids. So far, what did we understand? First, let me tell you and then make a good revision to you guys. First, what happens? One infected individual, infected individual A. Okay, he is infected, and then these are the stools of an infected individual, and these are the eggs. Okay, these are the eggs of an infected individual. This infected individual, the female is laying about one female is laying about 2,40,000 eggs in a day, and now these heavy eggs are excreted in the feces. Now in the environment they become embryonated. Okay, they become embryonated in the external environment, and from there they have become infective. Now they are active, they are infective. Okay, yeah, they are active and infective. Once they are active and infective, within 2 to 3 weeks, it takes about 2 to 3 weeks for them to become active and infected. Now, through the fecal-oral route, these eggs, through the inhalation or through the ingestion, by either of the method, okay? Through inhalation, one, it can go through inhalation, two, through ingestion. Through the fecal-oral route or through inhalation, what happens? The embryonated eggs are ingested by the man, and they enter the small intestine and hatch open. Okay, they have entered into the intestines of this person, into the small intestines, especially the jejunum, and they have hatched open here. Once they open, what happens? They undergo the molt. They undergo the molting. Then the larvae penetrate the gut wall, and it goes into the various other organs. So from the intestines they hatch open. This is the larvae, and this larvae has started to penetrate from the intestine, and then it reaches up into the, from the intestine it goes to the liver, and from the liver it can also go to the lungs. Via the bloodstream, through the hematogenous spread, it can enter into the lungs, it can enter into the liver. Various widespread action of Ascaris lumbricoids can be seen. And again in the lung they will molt twice. They go to the alveolar walls, they migrate into the bronchioles, and they are cuffed up through the trachea. Now let me show you. So far you have understood, from a person through the stools, fecal-oral route ingested by person B, and in the intestines they will undergo molting, and from there what happens? Once they undergo the molting, the larvae will hatch. Through the hematogenous spread it enters into the liver. From the liver it can, through the hematogenous spread, it can also go into the lungs, and in the lungs they will undergo the molting twice. Okay, they undergo the molting twice. They break through the alveolar walls and enters into the bronchioles, alveolar walls, bronchioles, and once they are cuffed up, and again when they are cuffed up, what happens? Through the sputum, when it is swallowed back by the human host, again it goes back through the esophagus into the stomach and then into the intestines, and reaching the intestines they turn into a mature adult. Is it clear? Did you understand the life cycle? Person A to B through the fecal-oral route, through the fecal-oral route into the intestines, from the intestines liver, and then from the intestine what happens? The eggs hatch into larvae. From the larvae it goes into the liver, lungs, cuffed up, and then ingested again, goes into the intestines again and become the adult. Now let us see in the picture here. First, point number 1, infected eggs are swallowed. Eggs are reaching the intestine. and they hatch open, and the larvae is migrating to the hepatic portal, to the liver, 1 or 2 dpi. Okay, and then we see 1 to 2 days post infection. Then comes the larvae is entering into the lungs 5 to 6 days post infection, and the alveolar spaces also it enters, bronchioles, and it causes cough. Once it is coughed up, the larvae are again swallowed, reaches back into the intestines for the second time. They become mature within 50 to 55 days post infection, and the adult worms will again start to lay eggs. Is it clear? In the soil, it grows under the favorable environmental conditions. So here from the intestine, how does it enter into the liver? In the duodenum, the digestive juices will weaken the eggshell and they will stimulate the enclosed larva into the activity. Is it clear? How do they become active? Because those digestive juices in the duodenum, they will weaken down the eggshell, whatever the protective covering was there, and they have become loosened and it has enclosed the larva into the activity. And then they start burrowing the mucous membrane of the small intestine, enters into the blood spread, and the larvae start spreading into the liver, then into the lungs. They are coughed up, gone back into the liver. The molting of the larvae occurs one outside within the eggshell. So molting, how many times it occurs? Outside the environment, one outside. Okay, while the egg is within the shell, the egg goes molting, and the egg goes molting twice in the lungs and once in the intestine. Okay, 4 total mountings, 2 in the lungs, 1 in intestine, 1 within the eggshell. Is it clear? Do you want me to quickly put down the graph again, a flow chart? Okay, before going to the clinical features, let me just put down a flow chart for you here in the life cycle. I hope it is clear, but anyhow we will revise it again for a better understanding. Or to the pictures only. Infective eggs are swallowed, reaches intestine, larvae will migrate to the liver, and through the intestinal wall it goes into the liver and then into the lungs. Through the alveolar spaces it is coughed up. When the sputum is swallowed by the infected individual, what happens? The larvae will reach the small intestine and turns into an adult worm and starts laying the eggs. I hope it is clear. Now we'll move further to the clinical features. The symptoms can be due to the migrating larvae or the symptoms can be due to the adult worms. So let us see what are the symptoms which are because of the migrating larvae. To begin with, when it infects the lungs, so what happens? So the migrating larvae may cause cause the fever, cough, okay, cough, sputum production, and then we have Ascaris pneumonia or Loeffler's syndrome. What is Loeffler's syndrome? Loeffler's syndrome is nothing but during the larval migration phase, whenever it enters the lungs, the host starts to experience an immune mediated inflammatory reaction. This immune mediated inflammatory reaction is known as Loeffler's syndrome. Loeffler's syndrome is also known as eosinophilic pneumonitis. It is a type of eosinophilic pneumonitis known as eosinophilic pneumonia, which is quite similar to the clinical presentations of community acquired pneumonia and similar to the asthma. Okay, it arises from Ascaris lumbricoides in a child. Is it clear? In the lungs, it causes Loeffler's syndrome. What do you mean by Loeffler's syndrome or Ascaris pneumonia? It is nothing but the immune mediated inflammatory reaction. It is also known as eosinophilic pneumonitis. What is the clinical presentation? The patient may have similar presentations like community acquired pneumonia or asthma, and the symptoms include cough, hemoptysis, that is fresh blood in the sputum, and then we have wheezing, dyspnea, and then what is the triad? Pulmonary infiltrates, peripheral eosinophilia, and the respiratory symptoms. What are the respiratory symptoms we saw? Cough, wheezing, asthma type of symptoms like cough, wheeze, shortness of the breath, that is nothing but dyspnea, and then the patient can also have low grade fever. Eosinophilia, peripheral eosinophilia. What is eosinophilia? A high level of eosinophil count in the blood. Eosinophils are nothing but a type of white blood cells, right? So it is a type of white blood cells which are obviously it will be increased. White blood cells will be increased during infection. So eosinophilia is nothing but philia is high level of eosinophils in the blood. And we also have pulmonary infiltrates which can be seen through the examination. And then the patient can also present with cough, low grade fever, sputum accumulation, and urticaria, hives or other skin rashes. And then the sputum can contain the worms. And then we have the edema, swelling of the face, conjunctivitis, etc. Okay, the patient is presenting with urticaria. You can see urticaria or hives, cough, sputum production, and then we have low grade fever and eosinophil. This is a normal eosinophil count. Eosinophils are under a normal range. Here eosinophilia is eosinophils above the normal range. Then comes the symptoms which are because of an adult worm. Due to an adult worm, let's see what are the symptoms. The symptoms related to the number of worms harbored. So we see that when we come to the symptoms of an adult worm, it depends upon the number of the worms which are harbored by the body. Is it clear? The amount or the quantity of worms which are harbored by the individual. People can present with a light infection, usually having no symptoms, to the spoliative action. Is it clear? It can start with a mild, having a mild infection with no symptoms, or spoliative action of Ascaris lumbricoides. What is spoliative action? It refers to the nutritional deprivation which is experienced by the host because of the worms which are competing for the consumption of the partially digested food. They are robbing off the host of its nutrition. The spoliative action is what? They completely rob the individual from the nutrition. What do? I told you they will compete for gaining the nutrition. Now if the child or the individual consumes something and it starts getting halfly digested, partially digested in the small intestine, these worms will take away all the nutrition and deprive the individual from the nutrition. And also it is known to cause the vitamin A deficiency, leading to night blindness. And then we see that malnutrition is very common in the children because the deprivation of nutrition is seen. Due to this nutritional deficiencies and protein energy malnutrition, the children can present with kwashiorkor and marasmus. In kwashiorkor, the child presents with a belly, okay, and there is edema present, okay, bulging abdomen, ascites, edema is there, moon faces, thin and brittle hair. Whereas marasmus, the child is completely deprived of fat and protein. There is thin and brittle hair, simian faces, and complete loss of muscle mass. Is it clear? Then comes to the toxic action. The body fluids of Ascaris, when absorbed, is toxic. Okay, whenever the body fluids, or you can say the waste products or the body fluids which are released by the worms, don't get confused here. The toxic action we are talking about the body fluids or the waste products. These are the waste products or the body fluids released by the worms. Is it clear? The body products or the fluids are released by the worms. They cause an allergic reaction. You can also call this waste products as ascaron. Okay, ascaron. This ascaron or the waste products or the body fluids, they can act as an allergen, especially in the sensitive individuals, and lead to various symptoms. Is it clear? It can cause urticaria or hives, or you can see other types of skin rashes, edema, swelling of the face. It can cause mild grade fever, and then we have urticaria, edema, swelling of the face, and the patient can also present with conjunctivitis and irritation of the upper respiratory tract. Is it clear? irritation of the upper respiratory tract. Whenever there is inhalation of the worms, it can lead to the irritation of the upper respiratory tract. Then this is about the toxic action. Is it clear? Toxic action is because of body fluid of Ascariasis. Whenever it is absorbed, it is very toxic and it will give rise to urticaria, edema, conjunctivitis, low grade fever, irritation of upper respiratory tract. Now let us see what are the mechanical effects. It can lead to uh, intussusception and obstruction of the bowel, intestinal obstruction. So what happens when there is too much worm accumulation? It can obstruct the bowel. What happens when these bacteria also follows in? Once there is an obstruction, then it leads to infection. There is too much inflammatory condition there going on, and all of these will lead to obstruction. And this obstruction can also present in the form of intussusception. Is it clear? So the intestinal obstruction caused by the worms and intussusception, these are the mechanical effects. Then we'll see about the ectopic ascariasis. What is ectopic ascariasis? So you can also see that there are various spasms. This neurotoxins are also released by the worms at times. These proteinaceous neurotoxins, which are produced by the worms, they will start causing the spasms of the small intestinal muscles. You can clearly see that there is too much spasms of the small intestinal muscles. They will contribute to the formation of worm masses. All the worm masses will get accumulated, and this will lead to the intestinal obstruction and intussusception. Next, we will see about the ectopic ascariasis. Worms can start to migrate upwards from the intestine into the stomach. So we see from the intestine, what happens? From the intestine, the worms will start migrating. The worms can start migrating into the stomach, and then into the stomach they can also go into the esophagus. It enters the stomach and then it enters the esophagus. Okay, then we'll see. So this worms can lead to, what does the patient present with? He presents with nausea, vomiting, especially of the live worms. It is psychologically very distressing to see worms in your vomit. So the nausea, vomiting, so the patient has to be told about these symptoms, that he can present with all this during the deworming period, that it can be psychologically distressing. So preparing the patient mentally is important. So when the worms are migrating from the intestine to the stomach and esophagus, the patient presents with nausea and vomiting of the live worms. And also the pyloric obstruction can also occur. Okay, the pyloric obstruction symptoms again will be vomiting, abdominal pain, especially the exit of the stomach is blocked. So we see that because of the pyloric obstruction, the patient can also present with vomiting. Then comes the worms which can migrate up into the esophagus, and there is live worms seen from the mouth and coming through the nose. Okay, is it clear? Worms can migrate upward and they can also be expelled through the mouth openings. Okay, through the mouth and through the nose also it can get expelled. Next, we will move further. The acute appendicitis is seen if the worms enter the bile duct, and through the pancreatic duct or the bile duct, the patient can also experience about the gangrene of appendix. And acute appendicitis, the worms will start spreading to various areas in the appendix. It can cause potential appendicitis and gangrene of the appendix. And as I said you, the worms will also enter the bile duct, pancreatic duct. You can see here, it can enter the bile duct and pancreatic duct through the ampulla of Vater. Let me write it down here. Okay, so the through the ampulla of Vater, the worms can enter the pancreatic duct, common bile duct. They enter into the liver. In the liver, they can cause cholangitis. The biliary tract is involved, and it can result in right upper quadrant pain and jaundice, nausea, vomiting, fever, chills. There is yellowish discoloration of the skin, and yellowing of the eyes are also seen here, and biliary colic can also be seen. Okay, next we will move further. What it does is bowel perforation. So the intestinal perforation or the bowel perforation will lead to peritonitis, and potentially even the septic shock can be seen. So the patient, how does it present? He presents with abdominal pain, rigidity, rebound tenderness. It is seen in cases of perforation. So what happens in perforation leads to peritonitis, and in peritonitis the patient can present with abdominal pain. Then he can present with rigidity. Along with rigidity, he can also present with rebound tenderness. Is it clear? Rebound tenderness. So the abdominal perforation, bowel perforation, and then we will move further. In the liver, it can also result in the severe inflammation of the biliary tract can be seen, and it can also cause the tissue and liver damages, tissue necrosis in the liver, and it can lead to the liver abscess. So how does this liver abscess occur? From this healthy liver, it has turned into an abscess of the liver. How does this occur? Once the adult worms or the larvae or the egg is migrating from the intestine into the biliary tract. Now let us see. From the intestine, this worm has traveled all the way through the blood spread into the liver. Once this worm, let us consider this is the worm, this is the larvae, and the egg. Okay, it has migrated into the intestine through the biliary tract or the liver parenchyma, enters into the liver parenchyma, and in the liver parenchyma it has started producing inflammation. Followed by inflammation, there is necrosis, tissue necrosis, the death. Okay, the death or the necrosis of the tissues, liver parenchyma, and the patient can also have localized bleeding within the liver and the bile duct. All of this inflammation and the necrosis can lead to the secondary invasion of bacteria. One, there was invasion of the worms, they cause all of the inflammation and necrosis. Secondary, there is bacterial invasion. This bacterial invasion, typically from where does this bacteria come? Like the normal gut microbiota, like E. coli, Klebsiella pneumoniae, whatever the normal gut flora is present, they will ascend into the biliary system via the portal vein, and they are tending to cause this secondary infection. So what happens as a body's immune response to this bacterial infection? This results in the localized collection of pus. It is causing the pyogenic liver abscess. Is it clear? You can see here, through the portal vein, what happens? Through the portal vein, they ascend into the biliary system via the portal vein. These E. coli, Klebsiella pneumonia, whatever is present in the intestines, gut flora, they will ascend upwards into the liver, and they are causing the localized bacterial infection. And as an immune response to this bacterial infection, the pus accumulation occurs. Okay, this is causing the pyogenic infection, pyogenic abscess, liver abscess. Okay, so the patient presents with abdominal pain, nutritional deprivation. So the World Health Organization definition of heavy infection of roundworm is more than or equal to 50,000 eggs per gram of feces. Can you see the amount of eggs which are shed in the per gram? Okay, let us consider just 1 gram of feces. In that 1 gram of feces, the eggs, quantity of eggs should be 50,000. 50, more than 50 or equal to, more than or equal to 50,000 eggs per gram of feces, then it is considered to be a heavy infection. Now let us move further to the laboratory diagnosis. The direct evidences is obtained from finding of the adult worms in the stools and in the vomiting of an individual. The administration of an anti-helminthic. What are the anti-helminthics? We know we have brands like Bandy Plus, and we have albendazole, mobendazole. So these antihelminths, when administered, they will lead to the expulsion of the worms, and its detection leads to the direct evidence of roundworm infection, which is nothing but Ascariasis. Now we'll see the X-ray diagnosis. The presence of Ascaris lumbricoides is demonstrated by radiography with barium emulsion. Whenever the barium emulsion, when being ingested by the worm, this liquid, whatever is used, this ink, whenever is ingested by the worm, within 4 to 6 hours, they will cast an opaque shadow, the string like shadow. So you can expect some MCQ also from here. The string like shadow appearance is found in which of the following? They'll say hookworm infection, ascariasis, and some other infections, whipworm infection. Then you can mark the answer as it is found in cases of Ascaris lumbricoides. This appearance is seen in cases of Ascariasis. Is it clear? A string like shadow. Why does the string like shadow appear? It is because there is presence of Ascaris lumbricoides on the barium emulsion. Through the radiography, this Ascaris lumbricoides has been demonstrated, because after the ingestion of the barium emulsion by the worm, it shows an opaque shadow appearance on the X-ray. Okay. Then finding of the eggs. That was the worms. Initially we saw the worms, direct evidences of the worms in the stool and the worms in the vomit. And then we see the X-ray string like shadow appearance in the radiography. And then we'll see next we have the finding of the eggs in stools, the direct microscopical examination of a saline emulsion of the stool. Okay, through the saline emulsion we are doing a direct microscopic examination of the stool, and the unfertilized eggs do not float in the salt solution. If a patient harbors only male Ascaris worms, the eggs are not found in the stool. Is it clear? If they are unfertilized, they do not float. If only male worms are seen in that individual, no female Ascariasis is seen, all males with a penile seta and the curved tail are seen, then eggs are not found in the stool. In the bile, it is obtained by duodenal intubation. In the bile, they do the direct microscopic examination of the bile and detect the worms. And then we'll see the indirect evidences is through the blood examination. These are indirect evidences through the blood examination. Then we see the normal eosinophil range is so much, whereas in cases of Ascaris lumbricoides infection, in case of Ascariasis, we see that the eosinophils are increased in number, eosinophils are above the normal range. And the dermal reaction, the scratch test is done with the powdered Ascaris antigen. Then we will see serological test. Is it clear? We saw the indirect evidences through the scratch test with the powdered Ascaris antigen. Okay. And then we have blood examination. Eosinophilia is seen, peripheral eosinophilia. And then we have serological test is used in the diagnosis of extraintestinal Ascariasis in cases of Loeffler's syndrome. We know when it enters the lungs, the patient presents with similar symptoms like that of pneumonia. So the larvae may be found in the sputum during the stage of migration. Is it clear? In Loeffler's syndrome, we see it in the sputum because it is commonly infecting the lungs. So you can find the larvae in the sputum during the stage of migration. Okay. And then we will move further to the differential diagnosis. The other parasitic infections are hookworms, and then enterobius, pinworm, etc. You can differentiate them based upon the appearance of the worms and their morphological structures, based upon the morphology of the eggs, larvae, and the worms via the stool microscopy. We can differentiate the diseases. So in the roundworms, we know how they look like: the male and the female, the curved one the male, the straight tail is the female. And then this one measures about 3 to 6 inches, whereas the whipworm measures about 2 to 3 inches, which we will discuss in detail about the whipworm. The entire session will be done in the next video. And then we have hookworm measuring about 1 by 8 inch, and less than 8 inch, just 8 inches is the tapeworm. Okay, is it clear? Up to 8 inches is tapeworm, and the rest are 2 to 3 inches whipworm, 3 to 6 inches is the roundworm. Then we see a malabsorption. Any parasitic infestations like hookworm and strongyloids, they present with malabsorption. The other causes, the differential diagnosis. Okay, we are seeing the other differential diagnosis which we can think of in cases of Ascaris. The other differential diagnoses are malabsorption. So any parasitic infestation like the hookworm, strongyloids, the other causes of malabsorption can be liver cirrhosis, the enzyme deficiency, Whipple procedure. They can be differentiated with relevant testing. Okay, is it clear? Next, we will see the bowel obstruction. Intestinal adhesions which are secondary to trauma, or the inflammatory bowel disease, herniation, foreign body ingestion can also present with a similar clinical scenario and should be differentiated radiographically. So when we do the radiographic study, we see the string-like appearance in cases of Ascariasis. Through these studies, we can differentiate between the bowel obstruction due to a foreign body and bowel obstruction due to Ascariasis worms. Then comes biliary obstruction. In biliary obstruction, it can be due to the intestinal fluke infections, or it can occur due to the gallstones with cholangitis or cholecystitis. Biliary obstruction can be because of the strictures. The scar-like formation will be there, strictures, complete narrowing of the canal, and it can also occur because of some malignancy there, cancer. So these can be differentiated again by radiographic images, including the endoscopic retrograde cholangiopancreatography, MRCP, and relevant laboratory tests can be carried out. Is it clear? And then we have acute pancreatitis. Acute pancreatitis, main commonly the patient will have in history of alcohol or previous, you can see the infection. Then comes the lung manifestations, eosinophilic pneumonitis. Pulmonary eosinophilia is seen with the various parasitic infections like filariasis, strongyloids, hookworms along with ascaris. This is confirmed by stool microscopy and epidemiological exposure. Is it clear? What are the various things we saw? Lung manifestations, under which we have eosinophilic pneumonitis. How can we rule out the eosinophilic pneumonitis from Ascariasis is through the stool microscopy and epidemiological exposure, and it is also found in other parasitic infections like filariasis, strongyloids, hookworms, etc. The patient can also present with asthma, hypersensitivity, pneumonitis. They should also be confirmed with relevant clinical labs and imaging. Okay, that is how we can rule out the Ascariasis from that of other manifestations of lung. Is it clear? Now let us quickly go through the differential diagnosis again. The differential diagnosis, we have hookworm, pinworms, hookworms, enterobius or pinworms. How can we differentiate them? Based upon their morphology. In the tape, okay, tape is the longest, 8 inches, and whipworm 2 to 3, roundworm 3 to 6. This is 1 by 8 hookworms. Now you can move further to the malabsorption. Malabsorption, the other causes for malabsorption: cirrhosis, enzyme deficiency, other parasitic infection, etc. In the bowel obstruction, it can be because of a foreign body, IBD, herniation, etc. Then biliary obstruction can be because of fluke infection, stones formation, and because of some stricture, malignancy. And how can you differentiate acute pancreatitis from that of Ascariasis? Is because there can be a history of alcohol in the patient or infections. Lung manifestations: asthma, hypersensitivity, pneumonitis, and eosinophilic pneumonitis. What are the three things we saw? Eosinophilic pneumonitis, asthma, uh, pulmonary eosinophilia is seen in cases of eosinophilic pneumonitis, hypersensitivity pneumonitis, and asthma. Okay. Moving further to the management. The allopathic management includes the albendazole, pyrantel, palmoate, and mebendazole. Is it clear? It includes it includes albendazole. It is given 400 mg. In less than 2 years, we give half of the tablet. Okay. Above 2 years to 19 years of age, one full tablet, 400 mg tablet. And then pyrantel palmoate. It is another alternative like that of albendazole and mebendazole. Mebendazole is again 500 mg. 500 mg can be given half in cases of children less than 2 years of age, and it can be given full tablet 500 mg, one single tablet in cases of an adult more than 2 years of age. And parental palmoate is a antihelminthic. Again, it is used to treat the infections. What does it do? The albendazole and mebendazole will deprive the glucose to the worm, and they die out of loss of food. Okay, loss of glucose. Whereas the pyrantel palmoate, what does it do? It works by binding to the nerve and muscle cells of the worms. They cause the paralysis, sudden contractions of the worms. They will lose the grip of the intestinal walls, and they get passed out of the body in the stools. It's kind of paralyzing the worms. This one, pyrantel palmoate, works upon the nerves and muscle cells of the worms and causes paralysis, and they lose the grip and they are passed out in the stool. Okay. How do we administer it? Usually it is given after food, and then it requires repeated doses after a couple of weeks so that we can prevent the reinfection from the pinworms or the roundworms, or the dosage will depend upon the age and weight of the child. Okay. Then the patient should be warned that they might expel the numerous whole large worms. Okay, you have to tell them not to panic whenever the worms come out to the vomiting, or they are seen most commonly through the stools. So whenever the worms appear in the stools, they have to be patient should be warned about it. And complete intestinal obstruction and its complications will also require urgent surgical intervention. So whenever there is a completely, if the intestines are blocked by the round of worms, then what happens? Group of worms join together, causing the obstruction there in the intestines that can require an urgent surgical intervention. Then comes the prevention and control. We have to avoid ingesting the soil which is contaminated with the human feces or pig feces. Do not ingest the soil. How can we not ingest the soil? Obviously by washing our hands thoroughly before and after food, washing hands after defecation, not ingesting the vegetables and the fruits which are grown in the human manure or pig manures. So they have to be thoroughly washed, cooked properly. Okay. Then we see night soiling is done, where human fecal matter is used to grow or fertilize the crops. That has to be avoided. Then we have waste water, that is the sewage water is used to fertilize the crops. That crops have to be avoided. Pig manure, whenever it is used to fertilize crops, has to be avoided because it is can be contaminated with the eggs or the worms of Ascariasis lumbricoids. And then we see we have to wash our hands with soap and water before handling the food. Very important. Even the cooks need to wash their hands because they can have the capacity to infect a large group of people. Wash, peel, or cook all the raw vegetables. We need to peel, wash them, and cook them very thoroughly before eating. All the raw vegetables, fruits have to be cleaned, cooked, and washed properly before eating, particularly those vegetables and fruits which are grown in the soil which is fertilized with the manure. Is it clear? And then we'll move further to the prophylaxis. Proper disposal of the human feces will cut down half of the spread of infection. And then the treatment of the parasitized individuals, deworming the individuals is very important. Even in the families, the children have to be dewormed. The adults have to take 1 dose of albendazole or mebendazole. And then the education of the children in the schools or on sanitary laws and hygiene is important. We have to reach out to the children at a young age, teach them to wash hands before eating food, wash hands after defecation, thorough washing of the hands. If they eat or consume the food which is with the contaminated hands, the worms can grow out and deprive them of all the nutrition. All of these simple education techniques and the washing hands, those techniques have to be taught to the children. And we have to educate the children on the sanitary laws and hygiene. Community chemotherapy programs also reduce the ascaris infection. Then comes the complications. We are very well aware from the differential diagnosis what are the possible complications. It can lead to intestinal obstruction, intussusception, growth retardation, kwashiorkor, marasmus, and then we have biliary obstruction, cholangitis, cholecystitis. You can also add on pancreatitis, and then you can add on liver abscess, all of these. And then we'll see to the prognosis. Excellent prognosis can be seen in cases of ascariasis if the treatment is given on time. Okay, then lastly we are going to discuss about the National Deworming Day. National Deworming Day is observed every year on February 10th in India to deworm the children between 1 year to 19 years of age. What do you mean by deworming? Deworming is nothing but using a medication to address the worm infections by completely eradicating the parasites or eradicating the intestinal worms in the child's body. What are we doing? We are using a medicine. We are eradicating the worms or parasites or the intestinal worms from the child's body. Simple. What is deworming? Using a medication to address worm infections by how are we addressing the worm infection? By eradicating parasites or the intestinal worms in the child's body. Government of India administer the deworming tablets through Anganwadi centers and schools in all states and union territories. What is the Government of India doing? It is administering the deworming tablets through the ground level, through the Anganwadi centers, through the schools, so that it reaches all the children of all the age groups in all the states and union territories. While the first round is conducted on February 10, it is followed up by the second round on August 10 every year. The three types of worms that infect people commonly is the roundworm, which is nothing but Ascaris lumbricoides, and we have whipworms, Trichuris trichuria, and then Trichuris trichura, and we also have hookworms. Is it clear? Thanks for watching. With this, we come to an end of the session, Ascariasis. I hope you have understood the topic, and if you have any doubts, please put them down in the comment section, and don't forget to hit the like button and subscribe.